Hi, I'm Dr. Trisha Stark, licensed psychologist and chair of the Task Force for Electronic Health Records for the Minnesota Psychological Association. The world of healthcare delivery is changing. And while change can be a challenge, it also brings with it many opportunities. Changes in payment and delivery models for mental health are advancing quickly. A key aspect used to tie care together and advance the triple aim of better quality care, a better experience for patients at reduced cost, is the use of interoperable electronic health records. Electronic health records, or EHRs, create the foundation that will allow the electronic exchange of information across the full continuum of care, including hospitals, clinics, mental health providers, social services, home health, public health, and long-term care. eHealth gives an opportunity for the health system to truly advance some core tenets that mental health providers have been speaking to. For example, the need to consider the whole person. By having a more comprehensive set of information available to all providers, our patients will be better understood and get better care. To be part of this evolutionary and revolutionary process, mental health providers will need to communicate relevant information through the use of electronic health records so that this information can be considered in a patient's overall treatment plan. The inclusion of mental health holds the promise to advance the needs of our patients with a recognition of all we have to offer. If we are to serve our patients in this way, we must participate in electronic health records, or we will become irrelevant and not serve our clients well. In 2007, the Minnesota State Legislature passed a statewide mandate for interoperable electronic health records. This mandate, which requires all providers of health services to have interoperable electronic health records by January 2015, provides an opportunity and resources for mental health providers. The state is recognizing the full continuum of care, and it's giving us assistance in evaluating our needs so we can adopt the health record that best fits our practices and our patients. As health reform progresses, there will be an expectation that mental health providers be fully involved in the care process. Payers will require it, and other providers will require it, so that all Minnesotans have the best integrated care based on the most complete knowledge of the patient and the treatment of the patient's health challenges. Many mental health providers have concerns about the privacy and security of information, given the sensitive nature of the information we record. Privacy and security concerns are essential to our work, and there are ways to protect information in the exchange process. It's important to keep in mind that not all of the information we might record will be exchanged with other providers. The most common information to be exchanged would be a diagnosis, procedure code, a problem list, and a treatment plan. Minnesota is also working on some innovative ways to manage consents for the electronic transfer of information that would provide additional protections for our patients. Also a concern for mental health providers is making the right choice of an electronic health record product. Resources are scarce, and no one wants to buy a product only to find out that it won't meet your needs. A decision-making tool is being developed to walk mental health providers through the process of assessing their needs, evaluating their options, and contracting with electronic health record vendors. Community discussions will be provided by state and national associations to help members make these choices. In addition to picking one, many mental health providers worry about the cost of an electronic health record system. In a time of declining reimbursements and reorganization of payment models, this can feel daunting. There are some resources to help with managing costs. For example, the state of Minnesota has an interest-free loan program available to help providers acquire and implement electronic health records. Provider organizations and community cooperatives are likely to be developed to use group purchasing tools to keep costs down. The most important reason for mental health providers to adopt electronic health records is to be sure that our clients and patients are receiving the highest quality care possible. For example, if we're working with an individual with diabetes who is seen by a podiatrist for foot sores related to diabetes, the podiatrist should know our client struggles with depression, which may interfere with self-care. Exchanging key information creates an opportunity for all providers to work in a concerted way so that the individual's health outcomes are optimized. Providers are also expected to gain benefits from electronic health records. Their use will simplify our collection of data throughout the treatment process. At intake, clients will be able to complete forms prior to the first visit so that the provider knows what concerns to anticipate. Clients can securely upload homework assignments, increasing accountability and improving outcomes. And administration of quality measures is simplified so that we have the best information about our clients' progress in treatment. Interoperable electronic health records will become a staple of how mental health providers give care. Just as we learn and adapt to new models of therapeutic intervention, we can adapt to this new tool for the provision of care. Learning and change are central to the work we do as mental health providers, and we can use these tools for change to incorporate electronic health records into our daily practice. We are fortunate in Minnesota that we have resources to assist us in learning about electronic health records, making choices about the best products for our clients and settings, and financial support to ease the cost of the adoption and implementation of electronic health records. Finally, I'm sure that we will find that the adoption of electronic health records will enhance the time and quality of our patient interactions when administrative tasks become more automatic.